This presentation focuses on addressing medical issues in a school setting, specifically for students with disabilities. School health services, medical services, and school nursing services are included in the Individuals with Disability Education Act 2004 as a related service in a child's individualized education program. These services are any health service that are designed to enable a child with a disability to receive free and appropriate public education within the public school system. In order for a child to receive these services, they must be outlined and described in duration, frequency, and location within a child's IEP. Medical services are services provided by a licensed physician. These can be related to assessment or diagnosis and can be requested by a school district. If a school district requests some kind of medical service, they are liable or they are responsible for funding that service. An example of this might be if a parent is requesting oral feeding of a student with G-tube feedings, the school district can request a physician to clear that student for or to do an evaluation to clear the student for oral feedings. School nurse services are tasks required and carried out by a school nurse. The school nurse can delegate some of her tasks to other school personnel. However, in the end, all tasks under school nursing services are legally assigned to the school nurse. So the school nurse would have legal responsibility for any of those tasks. And school health services are any other health services provided by either the school nurse or a qualified professional. The IDEA law limits the responsibility of a public agency, the school, to appropriately monitoring and maintaining the medical devices that are needed to maintain the health and safety of the child, including such functions of breathing, nutrition, or operation of other bodily functions during the time the child is being transported to and from school or while the child is at school. This also limits the responsibility to not include devices that are implanted within the child, such as cochlear implants or insulin pumps. The school district would also not be held responsible for funding such implanted devices. Tasks included in health services can include but are not limited to medication administration, toileting needs such as diaper changing or colostomy care, special feedings such as J-tube feedings, G-tube feedings, NG feedings, or changing the consistency of food to a puree or a thickened liquid if needed for the safety of feeding that child. Additionally, tracheotomy care is also included within the health services. Medically fragile is a term you'll hear used to describe students with complex medical or health issues. In Wisconsin, the Department of Instruction uses the term medically fragile within their website, but does not actually define it. And this is a common situation for many states. According to the American Federation of Teachers, a medically fragile student is one with special health care needs who requires complex medical procedures, specialized therapies, or specialized medical equipment or supplies in order to support or sustain his or her life during the time he or she is at school. It's important to note that medically fragile is not a federal disability category. The students with considered medically fragile are often identified for special education under another disability category, such as other health impairment, multiple disabilities, or orthopedic impairment. Once a student is eligible for special education, they are covered under the IDEA law and can receive health services as a related service. As there has been an increase in prevalence of mood disorders, ADHD, and other mental health issues in the pediatric population, so has also the increased administration of medications in school. This has become an increasing issue for school nurses and administration of school. Legally, school districts cannot refuse the administration of medication. This would become a case of discrimination, saying that a student would not be allowed to participate in their education without medication, but then not giving them the medication. Schools are allowed to administer non-prescription drugs as well as prescription drugs. The non-prescription drugs must have written parental consent and directions that are consistent with the original packaging directions for the student's age and weight. Prescription drugs must also have written parental consent, must come in their original container, and have a written directions and prescription from a medical practitioner. Glucogen and epinephrine are allowable drugs without written consent. Glucogen is allowed to be given by a school nurse for students known to have diabetes who are in a low blood sugar crisis. And epinephrine is allowed to be given, for example, like an EpiPen, if a student is having an allergic reaction and must get the medication. Both of these events must be followed up with a call to 911 if they are given without a previous consent. No matter who gives the medication, all medication dispersion must be documented. School districts will develop their policy on all the information that needs to be collected each time a medication is given. Wisconsin law states that no school employee is required to give medications by any means other than oral ingestion. The exception to this is licensed healthcare professionals, such as the school nurse. Any school staff that would be administering a medication in another form other than oral ingestion, such as inhalation, injection, rectal administration, or through a special feeding tube, must complete a DPI-approved training session. Again, no school employee is required to give these medications in any other format other than oral, other than the school nurse. However, willing team members are offered the opportunity to be trained to help and assist when needed. An example of this might be an anti-seizure medication that's only able to be administered rectally. Additional team members beyond the school nurse on that student's IEP team would be able to get trained to administer the medication if needed. For many different reasons, many students with disabilities experience a delay in toilet training skills. For some students, toilet training may not even be possible. Some of the related causes to this would be neurological damage, birth defects, or even significant emotional trauma. Delays in toileting skills can seriously impact social engagement and acceptance of a student with disabilities among their peer group. However, this can be addressed through careful planning and collaboration of the special education team. Important is to collaborate with the student's parents, all members of the IEP team, and also to include the student as much as possible. Certainly, the level of involvement of the student will vary with age and cognitive level. Additionally, it's very important to communicate between the general educator, the special educator, and any related services or paraprofessional support that might be involved in the toileting or changing of a student. It's important to identify ahead of time the facilities that will be needed and any kinds of supplies needed in order to be successful, and to think through the processes that will be used for changing a student. This becomes especially important when doing community outings, field trips, going to additional classrooms, or even just moving within the building. It's important to plan for when leakages or incontinence issues might happen in the classroom, and to prepare a student to be able to communicate what's going on without creating a social stigma for them. Critical to this process is remembering confidentiality and emphasizing the dignity of the student. Obviously, toileting is a very personal aspect of a student's day. And while peers in the classroom may suspect that something's going on, and we would want to make that better for the student as a special educator, we're not allowed to talk to other students about what's going on or explain that the student with a disability has an incontinence issue of any type. It should be a primary effort of all school systems to be creating a safe place for students to come and learn. However, it doesn't take very long watching the news or perusing the social media to see allegations and reports of misconduct and abuse of the very same students that we are there to serve. And the abuse and misconduct is happening by the professionals who are supposed to be teaching them. All school personnel have what is called an affirmative tort duty. This means that all school personnel, from teachers to administrators to paraprofessionals to the bus drivers, have a legal obligation to take reasonable action to prevent harm to students and to also help students who are hurt. This carries over into what's called reasonable supervision of students. Now, creating a safe environment must also comply with federal law. So IDEA says we must serve our students within the least restrictive environment for their learning. So increasing safety cannot cause a more restrictive placement for the students with disabilities. One way to approach this is really knowing the at-risk factors for students with disabilities. Knowing the students, what behavioral triggers or safety triggers or risks they have for themselves will help assist in planning for changes to increase school safety. Planning has to happen on two levels. First, it can happen for each individual student who's at risk. So for the students with disabilities, identifying what risk factors they have. For example, do they have physical limitations which decrease their ability to position or move themselves, or maybe impact their breathing in certain positions? Additionally, is the student with disabilities at a certain risk for bullying more than maybe other students? Knowing these risk factors can help the school system create different behavioral structures or supervision structures to decrease those risks from occurring. Additionally, systemic change can help with increasing school safety. So schools can help develop plans and policies that decrease bullying overall, increase training of overall needs of special needs, also addressing substitute teacher policies, and including all staff personnel from cafeteria workers to custodial staff to bus drivers in some of these conversations. The use of physical restraint and seclusion is also the source of much media attention and legal issues within the school district. Schools are required to balance safety for all students and educating all students, even those with significant behavioral issues or issues with aggressive behavior. In 2011, Wisconsin passed Act 125, which identifies and defines physical restraint and seclusion and lays out when it's able to be used and when it is not. Physical restraint is defined as a restriction that immobilizes or reduces the ability of a student to freely move his or her torso, arms, legs, or head. And seclusion is the involuntary confinement of a student, apart from other students, in a room or area from which the student is physically prevented from leaving. The 2011 Wisconsin Act 125 prohibits the use of seclusion in public schools, except for when the student's behavior presents an imminent risk to the physical safety of students or others, and it is the least restrictive intervention feasible. Basically, if there's any other way to help the child change their behavior without using seclusion, that's what you would do. Constant supervision must happen while the child is in seclusion, and the student must have adequate access to the bathroom, drinking water, any required medications, and regularly scheduled meals while in seclusion. An additional statement here is that seclusion must be used no longer than necessary to resolve the risk to physical safety of students or others. The room used for seclusion must be free of objects or fixtures that could be removed or could cause injury. There may not be any lock on the door, including the self-release locks, and it must meet all school building code requirements. This description is straight from the Wisconsin Department of Public Instruction's website regarding seclusion, and it's important to know the exact wording to be able to understand the intent of the act and then to be able to apply it to your specific school. The 2011 Wisconsin Act 125 also addresses the use of physical restraints. This act prohibits the use of physical restraint in public schools except when the student's behavior, again, presents an imminent risk to the physical safety of the students or to their own safety or to the safety of others, and that physical restraint is the least restrictive intervention feasible. Additionally, staff must know that there are no medical contraindications to its use. For example, a student with asthma who could have respiratory distress caused by physical restraint would not be a student allowed to use physical restraint on. Additionally, the degree of force and duration may not exceed what's necessary and reasonable to resolve the risk to the physical safety of the student or others, and no prohibited maneuver is used. The state outlines which maneuvers or techniques may be prohibited. These are anything that does not give adequate attention and care to protecting the student's head, anything that causes a chest compression or places pressure or weight on the student's neck, throat, head, or anything that would obstruct a student's circulation or breathing, as well as anything that would constitute corporal punishment. The school district will adopt a crisis intervention method, and all individuals involved at any time in physically restraining a student must have gone through the training and passed the training unless it's an emergency situation. In addition to these use of human physical restraint, the use of mechanical or chemical restraint is absolutely not allowed. This could include things such as chairs with straps on them or placing a tray over a student's lap in a seating device that the child is not able to remove for themselves. When students with an IEP need to be restrained or secluded, the IEP team must review the incident even after one instance of physical restraint or seclusion. If that child does not already have a completed functional behavior analysis and behavior plan, those need to occur. If the restraint and seclusion is happening, then a review of the existing behavior plan needs to happen and adjustments should be done. For students who are requiring frequent restraint or seclusion, an in-depth review of the behavior plan or redoing the functional behavior analysis needs to occur. Additionally, a possible recommendation for referral for mental health evaluation could be needed. Safety of school personnel is also very important. Working with students with disabilities can be a tough job, and injuries on the job are not uncommon. There are two different categories of injuries specifically related to staff working with students with disabilities. Sometimes injuries are related to aggressive behaviors of the students, such as scratching, hitting, biting. Other injuries can be related to the strain of lifting and moving individuals with disabilities, transferring people in and out of wheelchairs and the like. Injuries related to aggressive student behaviors can decrease with changes to the behavior response systems and also wearing protective equipment such as scratch-proof gloves or padded shoulder guards. Injuries related to moving of students with disabilities, helping them transfer in and out of wheelchairs, lifting them up to a changing table and the such, can also be improved, or injuries can be decreased with training on the proper body mechanics and lifting techniques, and also with the use of lifting equipment. In conclusion, there are many medical issues that staff working with students with disabilities come in contact with on a daily basis. The IDEA covers medical services for students with disabilities. This includes any kind of health service that the student would need in order to access their education. School personnel have a legal obligation to protect students with disabilities from harm and to assist them when they need it. The safety for students and staff is a critical component for effectively educating students with disabilities. All of you, the staff here at the school, are critical pieces to providing education for students with disabilities.